Good day everyone, I'm Brian Paulo B. Bruel and I'm here to discuss my case in pharmacology. So let's proceed to the discussion. So my case is, after a month of treatment with Pemolin for attention deficit disorder, a 9-year-old is to be reassessed to determine if treatment with the medication should continue. Discuss what information and observed behaviors would indicate that the Pemolin should be discontinued. Facts of my case are as follows. Number 1, a month of treatment of Pemolin for attention deficit disorder. And number 2, the 9-year-old is to be reassessed to determine if treatment with the medication should continue. The problem that needs to be addressed in my case is to determine the information and behavior of the patient that would warrant the discontinuation of the Pemolin. Before I proceed to the management of patient with ADD, I will give first a brief meaning of ADD. So what is ADD? ADD is a neurobiological disorder that makes it difficult for people to control their behavior or pay attention. It is usually diagnosed in childhood and often lasts into adulthood. Behavioral problems may include difficulty attending to instructions, focusing on schoolworks, keeping up with assignments, and completing tasks and social interactions. In addition, students with ADD may have learning disabilities and are often at risk for repeated disciplinary problems in schools. So how do we manage patients with ADD? There are two major approaches in managing ADD. One is through medications and the other is through non-medical means. Since our case focuses on medical approach using Pemolin, we focus our discussion on this matter. Pemolin is a central nervous system stimulant and is indicated for the treatment of ADD. It is marketed as betonamine, Cylert, Trodon, and Seractive. Because of the potential serious and sometimes life-threatening side effects, Pemolin is not considered as a first-line therapy for ADD. Patients receiving Pemolin must be monitored regularly because of its adverse effects. Potential side effects include non-specific prodromal symptoms such as anorexia, malaise, and certain gastrointestinal symptoms. In severe cases, it also includes yellowish discoloration of the skin and eyes, tea-colored urine, and elevation of liver enzymes. In this case, the patient and the family must discontinue the use of Pemolin and discuss the plan with their physician. Failure to discontinue may progress to liver damage, life-threatening hepatic failure, and possibly death. So for the appropriate nursing actions, the first thing that you need to do is to obtain an accurate medical history and perform physical assessment of the patient. These informations are essential to determine whether to continue or discontinue the use of Pemolin. Second, the parents must be informed of the possible physical signs that may suggest that liver dysfunction associated with Pemolin are setting in. These include abdominal pain, yellowish skin and eyes, tea-colored urine, nausea, vomiting, and unusual fatigue. Since our client is a child, the guardian or parent are the best informant where a good history can be obtained. Third is to inquire about the behavior of the child. If the child continues to be disorganized in major areas like in school, home, and social situations, or exhibits behavioral syndrome like short attention span, hyperactivity, emotional lability, and moderate to severe distractibility, then Pemolin must be discontinued. In the next part, I will tackle the questions that I have received during my report. The questions that I have received are the following. Number 1, would side or adverse effect reaction warrant discontinuing the drug? Of course, because Pemolin has the potential to cause liver damage that may lead to severe hepatic failure, causing liver transplant or even death. Number 2, what are the blood values and toxic levels you need to be vigilant with? The maximum recommended daily dose of Pemolin is 112.5 mg per day. Any excess would mean development of potential adverse effects like liver damage as manifested by abdominal pain, yellowish discoloration of the skin and eyes, tea-colored urine, and elevation of liver enzymes. Thank you for listening.